Welcome to our Dominican Hospital Emergency Department splinting video. Our nurse Esmeralda was assaulted by a patient with a murder stick earlier and has sustained a fracture, which we will now be splinting. Take it away, Zach.
Thank you. You'll want to source your splinting supplies before you get started. So you want to look at your patient's arm size and think about the orthoglass size that you want. You don't want to let it overlap, and you want to make sure that you're going to have some gaps on either side. So we're going to pick the 3-inch. You want to match your orthoglass size with your bias roll size. These come in the same sizes: 2-inch, 3-inch, 4-inch, and 5-inch. And you'll also want some padding, some scissors, and a bunch of pre-cut tape. All right, so we're not going to torture Esme. We're going to use her non-injured arm. So which arm is it that we're going to be splinting for you today?
My left.
Okay, so can I have you take your right arm, point your fingers straight up towards the ceiling like this? Perfect. So we're going to do what we call a sugar tongue. This is a pretty common splint. The provider should tell you where they want the splint to start and stop. Most of the time it's at the MCPs. So we're going to use this bias. We're not going to stretch it. We're going to make sure that it's nice and loose and not stretched out so we get a good measurement. We'll mark here and cut our bias so that we have a reference for our padding and our orthoglass. So this is the length that we're going to use for our splint. So we can lay our orthoglass out, stretch this stuff out. Most of these are going to be open already, these packages. It's really critical that you seal the package. If you leave the package open, the fiberglass inside will start to cure just with contact with the air. So we want to make sure that we use this big seal at the end every time that we're done cutting. So we're going to use the measurement that we have here. Feel the end to make sure that you actually have orthoglass all the way to the end, and then run this guy all the way to the point that you want to cut. There's handy dandy little cutting guides on the back here, so if you're smart you can start on that side and find exactly where you want to cut. You always want to give yourself about 2 marks past where the bias that you cut measured, because we're going to trim the ends so that there's no fiberglass poking out and injuring our patient or annoying them. Once you're ready to cut, get a nice sharp pair of scissors. Trauma shears work really well. Don't use your own trauma shears though. The fiberglass has an activating agent in it that will gum up all of your scissors, especially your nice trauma shears. Once you get that cut, you can pull this all the way out of the package. And if you're ready to splint right away, you can leave this out of the package. If you're going to set up and do any kind of reduction, you want to put this back in the package and roll it up. So right away, I'm going to fold the end of the orthoglass over so I have a little bit of a gap, and then preserve the rest so that we don't lose any of this orthoglass. It's expensive. We're done with that. The orthoglass comes inside of a casing. It's like a nylon casing. You just peel it open and you'll see that little ends are pretty sharp. Once this starts to harden up, these will poke into the skin of your patient. So we're gonna take and just cut the end so that we have a little bit of this nylon casing that'll come past the end of the orthoglass that's inside. So do it on both ends. This one's already set back a little bit because it was the beginning of the roll. So we're good there. Once we've done all the cutting that we need to do, make sure you take an alcohol swab and help us keep our scissors working. So just a quick swipe of the alcohol swab after you've done cutting will keep that agent from building up on the scissors and making the scissors not work. All right, so we've got our length here. We'll just double check it. Put that right arm up for me again. I'm gonna go from the elbow to the MCPs. We're gonna make sure that that looks good. I'm happy with how that looks. Next thing we're gonna do is add padding. So this orthoglass gets really hard. We wanna add extra padding, especially around the bony prominences, so that we don't end up causing any kind of like pressure or sore pressure injury. So we're gonna take the injured arm now, and can you take all of your jewelry off for me? I don't wanna get any of that jewelry trapped on your left arm.
I can't move my arm.
All right, I will do it for you.
It hurts a
Would
lot.
love to.
Ow! Ow! Zach, ow!
Oh, I'm sorry. I don't have an Apple Watch. I don't know how to work this. There we go. All right. Will these slide over?
Mm-hmm.
Okay. Make sure you take all of the jewelry off. We
That's
don't want to
permanent
trap.
jewelry.
No.
Sorry.
Great. Consult with your doctor about permanent jewelry before you splint that permanent jewelry on there. All right, same thing that we did with your uninjured arm. I want you to put your injured arm straight up. Point your fingers straight towards the ceiling. If you need help, you can source someone else to come in to help your patient hold the correct position. I'm gonna have you move this hand down. Are you okay holding that arm
No.
there?
It hurts.
I'm
It
sorry.
hurts a lot.
It's gonna feel so much better once we get this splint on. So the cotton wrap is just adding padding, so you can go add some extra wraps around the elbow, and then you want to cover all of the area that the orthoglass splint is going to go over. We don't want to leave any exposed skin that's not protected by this cotton. And we'll add a little extra around the wrist too, because we've got some bony prominences. When you feel like you've got enough on there, you just pull and tear the cotton and it comes right apart. To get the orthoglass to set up fast enough, we're gonna use the sink in the room, so make sure you pick a room that's got a sink and get a towel ready. We're gonna douse this in the sink, and then we gotta dry it off so that it doesn't hold moisture next to the skin of our patient. So just a quick run of water. You can kind of squeeze out the extra water, and then we'll use a towel and roll the orthoglass inside the towel and use some pressure to try and squeeze some of the water out. If it still feels pretty wet, you can grab a couple smaller towels or washcloths and just kind of run them down the length of the orthoglass to take some extra water off. You have about 3 minutes after you get it wet before it really starts hardening up. If you don't get it in position, then you'll have to start over again. You'll have to recut. So at this point, I'd love an extra set of hands to come and hold for me so that I can get the wrap done properly. So if you can just hold right there at the top. I'm gonna take the bias, and the bias has a stretch to it. We're gonna stretch it about 50%, and then we're gonna overlap each one of our rolls as we're applying it. We're gonna overlap about 50%. So I'm gonna start down here towards the elbow, and I just wanna fold that elbow in a little bit so it doesn't make a sharp point. And we'll go back towards the arm. We wanna cover all of the orthoglass. It's okay to go over the rolls that you've already created. And we pre-cut our tape because we have a couple hands working here, and one roll of this bias will not cover the entire splint. So we got to the end of that roll. We're just gonna apply one piece of tape to hold that in place, and then we're gonna start with our second roll. So I'll just go over the same spot that I just started in, or that I just ended at. Work up towards the hand. You can make a twist here and go over the thumb. And once it's completely covered, finish the roll out. And then you'll want to add a couple extra pieces of tape. If you have a really active kid or a really active adult, you want to add some extra pieces of tape to keep the bias from rolling, so you can run those lengthwise. And then make sure the provider should have told you what position they want, if there's any position, but if they just want like a neutral position, you want to flex the wrist back a little bit so that they've got just a very slight neutral position in their hand. And you can hold while the orthoglass is setting up. Make sure you don't squeeze the orthoglass, because you can leave imprints and you can create pressure points if you're squeezing the orthoglass. We're just gently pushing at the palm and bracing behind the wrist here to get that neutral wrist position. At this point, you can ask the patient, they should start to feel the orthoglass getting warm. That's the active setup of the hardening of the orthoglass. Does it feel like it's warm on your arm?
Mm-hmm. It is.
And you're gonna hold here for about 2 minutes. All right, so our orthoglass is set up. It's nice and rigid. You can feel right at the edges. It'll feel nice and solid. At that point, you're gonna put your patient into a sling for their comfort. Sling works really nicely to hold an ice pack in place too. Up and around. You can tuck your ice pack right in with your sling here. And then give me a little finger wiggle. Can you feel me touching your finger?
Yes.
All right, and let's do a little capillary refill check. We got good cap refill. We're gonna let them know to watch for any kind of color change in their fingers. We don't want dark purple or bright white. If they have dark purple fingers or bright white fingers, we wanna encourage them to come back. That means that the blood's either not getting in or not getting out. If they got numbness or tingling, or the pain is just like out of step with where it's been, it's really going up and up regardless of the medications that they're taking, we want to encourage them to come back in so we can check to make sure that there isn't any kind of restriction. They haven't gotten so much swelling going underneath the splint that, you know, they've stretched out that material. So the idea with these splints is that we leave a relief on both sides so that the body can swell. We're not putting a cast on, because that can turn into a tourniquet. So we're gonna let them know, check for that CSM, any numbness, tingling, purple fingers, white fingers. We want you to come back and see us so that we can check that splint.
Okay.